Good morning, everybody. I'm David Jerome with the Chamber of Commerce, and today our guest is Dr. Alozie. Now, Dr. Alozie is the Chief Medical Officer for DeSalle Medical Center, which is a huge accomplishment in its own right, and I think especially interesting to us right now. He specializes in infectious diseases, which obviously with COVID-19, this is a very interesting conversation to have with Dr. Alozie. The other thing that you should know too is that I first met Dr. Alozie when we had him do a TEDx El Paso talk on digital, all things digital, and it was so we know what his passions are as well in terms of when he's not practicing as a doctor, or maybe there's a lot of overlap in that as well. So I think we can talk about that in a moment. But to tee this up, Doctor, if you don't mind, I'd like to sort of paint a picture for you to react to on the nature of this crisis. And I'm quite fond right now of sort of counting this crisis this way, or recounting it this way. We have obviously a huge healthcare tragedy that COVID-19 represents, but it's leading to a business set of business challenges that we've never seen before in our history. And as well, I think an information crisis. So where do we go to get good information? It's part of the reason we do this session right now. And having an infectious disease specialist on obviously is part of us trying to make sure that we propagate good information for people so they can make some smart decisions. And let me just put it this way too, is that when let's talk about this phased reopening and why it's necessary. It's sort of like a razor's edge we're expected to walk on right now. And you can characterize it perhaps better than me, but I will only say this: we've had 30 million jobs claims happen within 4 weeks. 1/3 of all jobs that still remain are still vulnerable. And small business, which always comprises the majority of an economy, is especially vulnerable to this right now. So we never really, I guess, thought that in the long term, and you correct me on any of this that you think is necessary, we never really thought the long term that the shutdown was sustainable in the long term, that some kind of phased reopening would have to happen. And maybe we could just talk about your impressions on that and what a phased reopening really does mean.
So I think one of the things, and first of all, thanks for having me on. I think one of the first things that you sort of get into this space where you make an assumption that everybody understands what the sort of hashtag stay at home or flattening the curve was supposed to be in the first place. The stay at home measures, the mitigation measures, right, were never intended to last forever. They were supposed to reduce the burden of disease wherever it was, right? New York was the real epicenter in the United States, New Orleans, Chicago, Detroit, Washington as well, but it was never intended to last forever. It was a conversation about let's ensure that our healthcare system doesn't break. So in some places it hit the precipice, didn't necessarily go over the precipice. Remember, a lot of the places that they set up in New York, they never used them. Right. So the places that they put beds and such in the stadium. And so we're in this space where there's a great article in the New York Times, I think middle of March, called The Hammer and the Dance, where we dropped the hammer on the country. And now we have to figure out what that dance is. And just like any other relationship or any other process, we may need a hammer again. We may be able to dance faster and faster, further and further into the dance floor. But I think the core tenet here is that we're not done. We don't know what the future is going to look like, but we do need to find ways to live with the virus. And whether that's around opening up business at a 25% or a 50%, who goes back to school, who doesn't go back to school, who are the essential workers, apart from healthcare, that need to be delivering anything, right? Any sort of delivery, whether it's USPS, FedEx, UPS, right? Whether it's food delivery, whether it's sanitation. There are all sorts of individuals, people, and sectors that can't stay at home. And the reality, like you said, 33 million people unemployed, 1/3 of the people that are still employed at risk, And I'm going to share something because I think it's important for people to understand something, that when we talk about going back, right, people say, well, reopening too soon, reclosing thereafter. Society, we're all tired of waiting. We just want it to open. And you see the Grim Reaper. Part of the issue is that this is not a conversation of open or not. This is open table data from before the shutdown in March. And you can see 73% of people were already not going to restaurants and going out ever before the governors put those things into effect. And I think if you look at this as well, this is MasterCard data that was released today. And in that MasterCard data, you can see over here that people are beginning to use their cards again, right? So obviously cards being present, no movement, people aren't going to do that. Total is down, but people that are non-travel usage of MasterCard, which makes up a third of all credit card companies, it's beginning to go back up again. And so when we say, how do we take those next steps, people are going to decide when they feel comfortable and when they feel safe.
That's wonderful. And I think, you know, part of it is that we'll talk about what we're calling the demand shock in a moment, because I think you just touched upon it in a very good way. But I think the phased reopening, you know, the guidelines that people are trying to follow, and this is, I think, the test of everybody going forward, right? At some levels, with absent a vaccine, which you can feel free to comment on as you think. We're all trying to make sure that we don't fill hospital beds to capacity, right? But at the same time, that we are beginning to return to some degree of economic health as well. And so some of the things that have been discussed, and maybe you can underline or comment on them, is maintain social distancing. So for example, at the chamber, if you don't need to come in, don't. If you're comfortable being on a Zoom call and that's what you think, do it. We encourage it. But if you do come in, wear a mask, so practice social distancing, wash your hands. I mean, these sound like very sort of, we've heard them 1,000 times now, and maybe our hands are tired of being washed so often, but too bad, right? I mean, that's the new normal, absent a vaccine. Even with one, maybe we'll continue some of these things. What are your thoughts on those kinds of recommendations as we try to, you know, return to some degree of what that next normal means without a vaccine? What are those steps that do you mind underlining them or modifying what I just said in any way you think is appropriate?
You mentioned the vaccine piece, right? And I think, again, reasonable people can look at things in very divergent manners. But what we know from history is that the fastest time we've gotten to vaccine development has been about 4 years, right? 1950. And yes, technology is better than it was then. We probably have a number of vaccine candidates, not probably, there are a number of vaccine candidates already being worked on by a host of organizations, both in the United States, Europe, and in China. But again, it has to go through phase 1, 2, and 3. It has to be safe. And then we have an issue of manufacturing. On average, let's say we manufacture 15 million, 20 million vaccines a year. 5 million go to under 5 kids. Another 5 million go to people above 65. There's a plethora of vaccines in the middle around a host of other things. And we're talking about scaling to, if we talk about herd immunity and getting to 60 or 70% of our population, 200 million plus doses of vaccine. We don't have the manufacturing capacity to do that today. And we can't turn it on.
So what's your timeline for a vaccine? If everything went to a normal plan, let's not be overly optimistic or pessimistic. When do you, and I know I'm asking you to look into a crystal ball, so apologies, but what are you thinking?
Yeah, in the absence of being Nostradamus, I think it is 12 to 18 months at best. If we get lucky, it's at best. And even if we do get lucky, let's even assume that some of the things you hear in the press around getting a vaccine by the fall are possible. Remember, the companies saying this are even saying they'll have a few 100,000 doses of vaccine. So then becomes the conversation, who do you give those to? I think it's also important to realize
folks like you, I hope. You're at the front lines of this, right? I mean,
fair enough, but it wouldn't come to El Paso. I mean, you look at remdesivir, one of the drugs that the FDA approved under emergency use authorization. I think El Paso only got enough to treat 8 to 10 people, right? And went to the county hospital and where it should go for the time being. But again, I think understanding that it wouldn't be enough to treat the people that need it, you're going to have to overcome the fact that we are highly divided in this country. And there's already a host of paranoid sort of things out there around the vaccine hoax. And then, and nobody wants to talk about this, but we should at some point, you're going to have a conversation in the South about how do you convince people who are still engaged in the trauma of Tuskegee to take a vaccine.
Right.
Those are all those pieces, but let's put that aside. I think that again, I try to avoid the zealotry that you hear in social media or sort of the talking heads of it has to be this or it has to be this. I truly believe anybody that tells you that there's only one way out of this, you need to show them the door, because we're building this plane as we fly it. There's no way for one person, unless they're a deity, to know the only way to work through it. And so I think, and I've said this before, given our social isolation, geographic isolation actually in El Paso, we don't have direct flights from Europe or from China or even from the big cities in the United States. That's helped us. That's helped slow the spread of disease because people coming from Europe and Asia couldn't get here with one flight.
Right.
For a host of reasons, we didn't have a lot of people that went there from a volume standpoint. You can understand why New York got hit so hard. They put 200,000 people into New York in under 30 days, right? And so that's part of that. I think the concern is Juarez, right? So those are all sort of epidemiological dynamic factors that we may or may not be able to account for. But when you look at how we're doing in our city, yes, we've had, unfortunately, 41 deaths. We wish we hadn't. Yes, our hospitals seem to be filling up a little bit. There's some conversation about the Easter rush and what Mother's Day may have done. We probably didn't do social distancing and stay at home as much as we would have liked to. In saying that, as we open up, the places I've been so far to do pickup and such, they've done a good job. They're wearing masks. They're wearing gloves. You see them disinfect. They're operating at 0.25% capacity at the moment, right? I know that some places like hair salons and barbers and beauty places, they're opening up. It'll be interesting to see how that goes. I hope that somebody's looking to see, do they have the right cleaning materials? Are they overbooking, right? So there are too many people in there. Everybody mandated or requested to wear a mask, right? And I think those are some of the things that we're going to have to see. And then from a public health standpoint, if we have enough testing, so we can test people in a sort of surveillance manner and make sure that these hot spots don't start to pop up. Because like I said, it's the hammer and the dance. We're in dance mode. As long as the dance continues to go and we don't fall, then we continue dancing. When we pick up that there's an increase in ICU or ventilator use or hospitalizations, we need to understand that this is not ending this summer. This is going to 2020 and beyond. And so we're going to have to figure out that accordion of really figure out what's safe for our community.
Interesting. I do think it's one of those things where as you call it, the dance. I think if we continue that metaphor for a moment and think about the dance card, clearly we don't want to fill it up too much in terms of, I think it's probably ICU hospital beds are probably the biggest indicator there, where we might want to slow the dance and maybe think about a hammer, because clearly you don't want to stretch that. Where we don't have enough beds to cover people and ventilators and things of that sort. So we do have some natural sort of places to look for how to be smart on this. You also mentioned something that I think is extremely important not to lose sight of, is that I think in times like this, it's very important to be critical and very important to, especially in terms of how we learn and to do better, because there is no manual. And there's much to be critical about because there is no manual. And as you say, we're trying to do it as we go. But I do think it's also important to recount and be grateful and count our blessings a little bit as well. And when you talk about the city, the county, and even businesses, I've noticed most businesses I've encountered to be quite not only resilient, but quite reasonable in how they're behaving and quite careful with their customers and their staff. And you mentioned that you thought we were doing fairly well in that space at some levels as well. How do you, when you look at what we can learn and we look at sort of the playbook and how it's rolling out, do you agree with that assessment? Do we have some things to be grateful for as well?
Yeah, I mean, I'll be honest with you. Initially, when I heard we were going to 25% and 50%, I wasn't necessarily a fan because I was only wearing my physician hat.
Yeah.
And my physician, infectious disease, epidemiology hat told me too soon. Our numbers aren't there yet. We have a trend up of cases. Our what's called COVID positivity rate is trending up. It concerned me, all right? Understanding, however, and this is where you sort of take off that hat and engaging with people that are non-physicians, that have their lives in the business world, that are teachers, that need to go out to make a living and pay rent and pay other employees or even get paid themselves. We can't keep them locked up forever. And so we have to figure out a way to allow society to start to expand while protecting our most vulnerable. And so that's why I'm actually very happy and proud of our health department and Dr. Okaranza and the fact that they're actually starting to do some global testing for all the nursing homes and long-term care facilities in El Paso. That's exciting because if you look at our unfortunate death toll, majority of those fatalities have been in that above 60%, right? And some of them have been out of nursing homes. And so if we look at what's happened across the country, we need to protect our vulnerable, right? And so, but to answer your direct question, I think those that have opened, they're scared as well. I've talked to some business owners, but they also realize that they are taking care of not just their families, but other people's families. And so they're doing this slowly. They're doing this deliberately. I've talked to other friends and other business owners just randomly that I've run into. I said, what's your plan? And a lot of them are afraid to open because they don't know if they're going to have to close again in 90 days or 60 days, in 30 days. And there's a business owner on the West Side, they increased their prices around some services, and I heard they got some backlash. But you can't blame them because the fact that they're not at capacity is a revenue loss. The fact that they have to have increased cleaning supplies, potentially plexiglass, the personal protective equipment around gloves and masks. We haven't even gotten to a conversation if private businesses want to start testing. Who offsets that testing cost for them? So their overhead went from here to here, and they have to find a way to offset that. So I do understand that. But I think people are trying to do their best. I truly don't believe there's anybody that's malicious, deliberate, or spiteful in this process. We're all trying to work together, whatever side of whatever divide we feel we may be on. And we just have to approach it with humility and understand that lives are at risk on both ends, the medical side and the financial side.
Yeah, I think that's exactly right. Very well stated. And you touched upon something that I think we've been sort of kicking around in the last few interviews that we've had, which is this idea of demand shock, which is the consumer themselves are trying to be careful. And even if you are open as a business, how many people feel comfortable going to this? Because it's, we can deal with certain kinds of shock to the system, like on supply side or something like that, with normal operational sort of challenges. But when the consumer themselves don't have confidence to re-enter the market, this uncertainty is part of the problem, right? Business doesn't like uncertainty, especially in the consumer, right? So no matter what you do from a business side, this remains at its core a healthcare concern for everybody. And it's going to be, even if business wants to reopen, if people are worried about their health, it's
not going to happen.
It's not at the rate we need even. So it's a complex area to be, which we like. I love the ideas. Unfortunately, we've had no playbook analogous. Before I switch to something other than COVID-19, which I intend to do with you, but I think the last thing I'd like to ask is that the chamber has 14,000 members, over 200,000 employees represented in that dialogue. And I think every one of us, all of us, And we have a question that just came in too, so I'll drop that on you as well. But before we do, the thing is that everybody wants to make sure that folks that are at the front line of this thing, you being one of them, get the support you need. Is there anything, or let me phrase it this way, maybe even better. If there's anything that we can do as a business community to support our healthcare professionals at the front line of this, please let us know now or in the future. And if there's anything that you think would be immediate, let me know. But I want to make sure you know, and I'll say this to all the listeners here, whether you want to do this on Facebook or you want to call us or you want to call Dr. Alozie or email him, perhaps better. I imagine you're sort of inundated with phone calls at the moment. But anything that we can do to support, we want to make sure that we're there for you. So do you have anything that's pressing, or would you like us to sort of run that dialogue for you over time?
That one of the things I've realized as we've sort of gone through this and trying to be as deliberate and diligent as possible to education, people are afraid. There's a disinformation out there. And so I appreciate a forum like this for people to sort of hear. And again, it's not to say that you or I have the truth, right? We just hopefully are trying to get to that idea of a North Star. How can we move forward? And so as long as the community as a whole realizes that all organizations are struggling through this, we're trying to navigate just like everybody else. We appreciate all the love and the contributions, and I will take the mantle of speaking for all the healthcare across the city for now. That, I mean, you see all the news stories of people that are bringing lunch and the gifts that they're bringing to hospitals and clinics and urgent cares. I mean, who would have thought, right, when people are suffering on their own financially, that they're looking beyond themselves? I think what I would ask anybody that's out there, if you could donate to whatever food shelf you are aligned with, the lines at the church food shelves, the El Pasoans giving, feeding for hunger. I mean, there's so much need out there. And so if that was my one plea, it would be for people to please donate as they can to the food shelves, because people are suffering.
That's wonderful. And we will go ahead and act accordingly. And we'll start a dialogue too that we keep alive with you on anything we can do to help. In that spirit, as soon as I even hinted that you would take questions, 3 have come in immediately. So may I do this? I'm going to go sort of really quick, because I actually do want to get to you a little bit, because I mean, people know you obviously as an infectious disease doctor, but there's also a side of you I want them to know as well. That's a little more personal. But here are the questions. I'm going to go through them sort of quick, and if you don't mind giving a sort of quick answer, we'll go there. First one out of the 3 that we have is, can you speak a little bit about this pediatric illness that is being linked to COVID?
Yeah, pediatric inflammatory, I think it's multi-system syndrome. You know, I'm not a pediatrician, and so that's not my space. I pretend to be a pediatrician at home with my 2 kids, but that's about it. I think that, again, people have to realize that this is a new virus that humanity has not seen. And so it's manifesting in a host of ways. They've given that sort of syndrome complex, those list of characteristics, a name. There's something about Kawasaki disease that New York seems to have had 40%, I think I saw somewhere, increase in Kawasaki disease in the last few months. Again, we're not sure what the driver is. I mean, a lot of times post-viral syndromes can lead to a Kawasaki in kids. But again, I'm not a pediatrician. I think yet to be determined. There's a lot of information that we're going to discover. And, you know, one of the things about the whole stay at home or flatten the curve wasn't just not to overwhelm the healthcare system, but to allow science kick in, right? If you look at the world database on clinical trials, I checked it on Monday, there were over 1,500 clinical trials ongoing across the world focused on coronavirus. That's the treatment and cure. And that doesn't even speak of all the journals that are being published around what it does to the human body. So I think we are going to have to get as much knowledge as we can, sort of give the standard of care management to all patients that come in, and really hope that we can give science a chance.
Excellent. Thank you. Here's the next one. Folks are hearing that staying indoors for a prolonged period of time weakens their immune system. Is that something that people should take seriously right now, or?
I mean, there's some conversations about hibernation. Human beings don't necessarily hibernate. Again, I'm not a hibernation expert per se. We've been indoors for 8 weeks, maybe 10 weeks. When you think of the human body and the human condition and how we evolve, we typically don't evolve over a 10-week period. This is years and years of evolution. If we were indoors for a couple of years, I think, and you changed your kind of allergen antibody complex combination, I'm not really sure that's something to be worried about at the moment.
Excellent. And then the last one, as you can sort of gather, this is where I remind myself that El Paso is largely a young city, because these are a lot about kids and things. But any tips or thoughts about students going back to school? And I realize that we're probably taking you to a full breath of medical advice.
Yeah, I mean,
but
I have given it some
any
thought.
initial sort of thinking? Yeah.
Yeah, I think, I have a 13-year-old daughter. She goes to Young Women's Academy and EPISD. My son goes to Mesita and EPISD, love both schools. And having conversations with both friends, principals, other people, I think there are a multitude of options, right? And again, anybody that says the one option is the right option, show them the door. That's not how we have to approach this. If we really think about the demographics of coronavirus, it doesn't affect kids as much. The concern is that even if it has a mortality rate in kids of 0.01, if you put 1 million kids on top of 0.01, that's 10,000 kids. Right? Mm-hmm. So I think as we open, that has to be at the back of our minds, that the numbers we have are based on the fact that we have shelter at home and we've kept kids out of the equation. Opening up school may be a staggered approach. The youngest go first for 2 to 4 weeks, and we see what happens, with the understanding that you have the ability to test the teachers and potentially do a random sampling of kids. Maybe you say those that are going into high school and college go first, right? And let's see how that goes. Maybe you do a condensed semester under usually 9 weeks, squeeze it into 4 weeks, understanding that you may have spread, and then you separate them again for another 2 to 4 weeks to allow that kind of burnout. Block scheduling, there's a whole host of things that I think, whether it's UTEP or the community college or the host of ISDs, they're going to have a plan. And I think more importantly than anything else, if the one thing, now that I said don't listen to one thing, that I would ask anybody is have a plan. This isn't Hail Mary time. This isn't, well, we'll just wing it time. I think it's important enough that any organization that truly believes they're doing this right has to have a plan. What are the prerequisites? What are the data points to move forward? The data points to move back? And what's your plan? Where do you want to go? How do you get there? I think every business owner you would know has a plan of how they wanted to open and how they wanted to get profits and how they wanted to segment the market. We now have to have a plan for how you get open and stay open.
Well, I think surprisingly, and maybe this is a good note on which to shift to other things in a moment, but I would say this is that Chamber is all about business, right? I mean, we're here because we want to help transform business and improve lives in this region. And business obviously represents, in our terms, we've had this conversation, sort of that vaccination against poverty, right? And we're trying to make sure that we sort of stretch the horizons for them of understanding and thinking, and why I think it's so helpful to have like a call like this, because I think as a small business owner, you get more information, you could be smarter as you put together a plan. But I would say this, I think that would be the first recommendation for business as well, not just public health officials or others. Put together a detailed roadmap for your reentry and how your revival is going to be sort of shaped. And I agree with you, whether you're a public official or you're a business, please do put together a detailed plan. And we're here for that. And part of this conversation should help as you formulate that. Just thinking on, how long the vaccine will take, for example, should be one of the things you factor into your plan. So, and we did discuss that already today. And I think 12 to to 18 months is optimistic. We're actually forecasting out into maybe third quarter 2022, just because of how long it takes to get things into the market, and vaccines being included. So anyway, I think this has been terrific at that level. But if I also want to give people some insight to you, because as I mentioned, I actually consider you a dear friend. And the first time I did meet you was at TEDx El Paso, where you were talking all things digital. And I was wondering, if I could use your hat in that way, because I do think as we think about business, and everybody is trying to figure out what's next, and they're all very concerned about the uncertainty that I think is one of the hallmarks of this crisis. What's next, right? And this makes trends and the analysis of things that are coming at us even more important now than ever, because I'm trying to pierce this fog that this thing creates in the short term, particularly. Those long-term trends still do exist. And even though COVID may have put a spin on them, or a curve, let's say, either accelerating or decelerating, things like digital are very interesting. And I know that's one of your passions. And maybe I could just get you to talk about that a little bit, again, in the spirit of helping business sort of factor in what this trend and what digital might mean for them, because you've integrated very well those things within your practice. So over to you for a moment, if you don't mind.
So I shared a screen. It's a cartoon that I found probably about a month ago. And as you know, when we first met, we had that conversation at TEDx El Paso. We talked about where is technology taking us. And as you know, in my former life at Texas Tech locally, it was always a push to say, how can technology catalyze? Understanding that we use PPT, people, process, technology. Technology is the last one specifically because you need the right people and you need the right process. Then you can catalyze it. It's ironic to me, and it was there and everywhere as I held multiple sort of positions at the state level talking about technology and healthcare. When you would tell people that technology is the future, even those in the technology healthcare space would say, well, it's a few years away. I'll give it another 5 to 10 years. And then coronavirus literally said, wait, hold my coffee. I got something that I got to do about this. And that's where we are. I mean, we saw the change in healthcare specifically go from, oh, we could never do a televisit. 72 hours later, both Governor Abbott, gratefully through HHSC, said payment parity. And then President Trump through CMS said payment parity. And now I'm talking to colleagues here and across the nation. Those that were already on a digital platform and had a channel into digital have seen the lowest drop in their volume because they were already digital. All they had to do was change the switch. And I mean, as you know, I run a nonprofit HIV clinic, the largest single clinic in El Paso. And we have had maybe a 10 to 15% volume drop. The biggest drop in volume is actually because people don't want to come do their labs. And we need those labs to manage their HIV condition, right? But people that were only doing in-person visits and had to find it out on the fly, they're down 30, 40, 50%. And that trend sort of lines up across the nation. And so, as you sort of mentioned, the jobs that are lost, the jobs that are potentially lost, I think either Forbes or Business Week did a poll of the CEOs and COOs of Fortune 100 a couple of weeks ago. And they said that they're actually reassessing what does work from home mean and why do those work from homers need to come back? Because if they're efficient and effective at home, then what is the point of paying the lease and rent of all these massive buildings? Facebook and Google have already said don't return until at least 2021, right? So people are working from home. And I think as we sort of look, and you and I have talked about this before, but as we sort of look at our community and where we can really start to catalyze growth and recovery, it's going to be ensuring that who has broadband, right? Do we have ubiquitous broadband in our community? Because if you don't have broadband, it doesn't matter that whatever ISD you're in is doing Zoom, or there's a host of tools that they proliferated in the last 2 months. If a kid can't get onto it, he can't get onto it. I've heard stories and I've seen coworkers and friends who have brought their kids to whatever hospital or clinic or business they work at, jumped on the public Wi-Fi and kept their kids in their car. so they can do their homework, they can do their meetings. That should never be the case. We have to do better as a community. And so when we talk about how does the chamber enhance and help and sort of prod people to think differently, it's looking at the organizations, whether it's Las Palmas del Sol or the Hospitals of Providence or UMC, have all of them put the proper public facing routers on their buildings, right, to provide free Wi-Fi. Right? Those are things that are not an incremental cost to them, because there's a host of companies in El Paso that have that expertise and can do that. Right? How do we ensure that our stake in our community, whether it's at a restaurant or a library or a gas station, somebody can access the internet to enhance that sort of drive? How do we ensure from a healthcare standpoint? I mean, Grubhub and Uber Eats and a host of other things have really saved a lot of restaurants recently, right? Because if they didn't exist, they would have had to start that infrastructure from scratch, but at least they could still deliver. Even though they were down 70, 80, 90% in talking to, for example, a couple of organizations that I know, at least Grubhub and Co. help them stay solvent, right? So I think technology is not going anywhere. Technology is going to continue to be a leading sort of goal or decision maker of how organizations are run. I think this time especially, as we're in a global pandemic that we've never seen before, people are going to need to be able to adjust and take advantage of technology, either through marketing or whatever it is, but ensuring that they have a digital footprint that their customers can access. Because the worst thing that could happen, I can't remember what I looked up the other day. I looked up a restaurant. We're going to do delivery at work. They had no website. And so, I mean, I had never asked for delivery. Great. But they had no website. They had Yelp, but the Yelp thing wasn't working. So there was a host of things. And I turned to one of my friends and was like, why are we ordering from these guys? This is taking me 30 minutes just to figure out where their menu is. Nothing should be that hard to order, right?
I think you're right. And, you know, it's the worst infectious disease in my book is poverty, because if people can't afford to do these things, they can't afford access. They can't get online and things. And I do think, you know, you rightly point out, it's quite clear that there's been an acceleration. Things like artificial intelligence and automation, we're already pushing a very strong sort of trend of digitalizing everything. And then when you look at decision making based on data sets and large data and things, this was already accelerating. I feel as though, and it sounds like you agree, as COVID-19 has accelerated that trend dramatically. And as fast as we think it's going, it's probably faster. What we don't want to accelerate, if I summarize your thinking on this, and I agree with you, is the sort of winners and losers in this thing, you know, already that gets wider than it's already been. So you don't want your economic winners and losers to create a further gap. And so I do think we have to be mindful of making sure that the acceleration of digital doesn't accelerate that gap between winners and losers as well, economically. So I think that's a very good challenge to the chamber. And, you know, the funny thing about it is even this thing is a nuanced kind of conversation, right? Because everybody has an internet hub in their hand.
Yeah.
It's just they can't afford it.
Very true.
They can't afford to use it.
Yeah.
And so it's an interesting time we live in, and we will continue this dialogue. I will only say it this way, my friend. It sounds like we have another TED Talk in the offing here. So we'll be back in touch with that as well.
It'll be an awesome TED Talk.
You know it. Listen, we're in the sort of on the limit of, I think, how long we should do this, just for your benefit and mindful of your time. Is there anything you'd like to wind up with before I close this off?
No, again, I think it's important for people just to understand that, again, nobody's malicious, nobody's trying to take advantage of anybody, and nobody's trying to cause discord. We're a community. We're going to need to figure out how to work through this, whether it's hammer or dance as a community, and whether that's testing, tracing, isolation, 25%, 50%. There's no one right answer. but we need a plan. People have to come together because no one organization is going to be able to create that plan. We need to come together and figure out what that plan is and what the flavors of the plan are and kind of go from there and be willing to be agile and flexible.
Well, Doctor, I know I speak for everybody at the Chamber, and I'm sure for our entire community when we say thank you for your leadership in this space. This is more cherished now than ever. I mean, who would have thought, right? But
Right.
This is where we are. And thank God we have leaders like you here to help us. And I want you to know that I speak on behalf of everybody at the Chamber for sure to say heartfelt thanks for all that you do for us every day. I can't imagine what it's like to wake up and go into this storm, but I appreciate that you are able to muster the will to do that. And so we thank you, and we are at your service when you need help or whatever. You don't hesitate to reach out to the Chamber. And in the meantime, thanks again. We'll get this posted and start sharing with folks. I think what has been a wonderful conversation. So thank you, Doctor, and we will talk to you soon.
You, appreciate it. Have a good day and
Bye now.
and be safe out there.
You too. Thank you. Bye now.